Assalamu alaikum everyone. Firstly, I really appreciate the fact that you all take out the time to listen to my presentation. And secondly, let me introduce myself. I'm Sir Sagir from the Department of PS Biotechnology. And the topic of my presentation is anorexia and anorexia nervosa. So let's start it. So here is the table of contents. The contents which we are covering in this presentation are obviously anorexia, the definition of anorexia, its origin, the symptoms of anorexia, and the warning signs of anorexia. Then we'll talk about anorexia nervosa. And then there are some questions related to anorexia and anorexia nervosa, that what happens to body in anorexia nervosa and why do people become anorexic. And then we'll talk about anorexia's effect on our body and who is more likely to become anorexic. And then we will discuss the treatment of anorexia. And lastly, that are anorexia and anorexia nervosa the same thing? So let's start with the definition of anorexia. The lack or loss of appetite for food, or an emotional disorder characterized by an obsessive desire to lose weight by refusing to eat. So these two are the definitions of anorexia. Basically, in anorexia, the person who is going through this eating disorder feels a loss of appetite, that the person doesn't want to eat and he feels that he doesn't need to eat at all. It is an emotional disorder, maybe because if we talk about on general terms, the person who is more conscious about his diet, about his fitness and all that, so that person basically skips his diet. He may feels that eating so much food may cause him problems and all of that, so the person refuses to eat in an obsessive desire to lose weight. Okay, the origin of anorexia. So there are two Greek words, an and orexis. An means without, orexis means appetite. Without appetite. And these are the Greek words. And then in late Latin, 16th century, it termed as anorexia. That without appetite, loss or lack of appetite. Okay, symptoms. The symptoms of anorexia. Extreme weight loss or not making expected developmental weight gains. Thin appearance, abnormal blood counts, fatigue, insomnia, dizziness or fainting, bluish discoloration of the fingers, hair that thins, breaks or falls out. In this condition, the symptoms are here. As you can see that in this condition, the persons who are suffering from this condition lost their weight, or they have very thin appearance. They don't have normal blood counts, fatigue. They become very weak. They feel very weak after doing something, not doing that heavy physical exercise, but they after doing a little walk, they feel just so very weakness. And then there is insomnia. Insomnia is basically a condition in which people lack of sleep, like you can see, and then dizziness or fainting. And there is the normal people, as you can as you know, that the normal people have the blue, you can say pinkish or reddish color of the fingers, hands, due to the blood circulating. But the persons suffering from this condition have bluish color. And then there is that hair that thins, breaks or falls out. Hair loss is the symptom of anorexia. Warning signs of anorexia. Here are the warning signs of anorexia: that constant worry about dieting, food calories and weight. You complain a lot about being fat. You refuse to eat whole groups of food like carbohydrates. You pretend you're not hungry when really you are. you stick to a difficult exercise schedule. Okay, then there is anorexia nervosa. Anorexia nervosa is characterized by emaciation, a relentless pursuit of thinness, and unwillingness to maintain a normal or healthy weight, a distortion of body image, and intense fear of gaining weight, a lack of menstruation among girls and women, and extremely disturbed eating behavior. Anorexia nervosa. In this condition, basically the women, more likely women are going through this disorder. They just want to be perfect, that they have that slimy look, or like so they don't eat as much, but that causes them weak. That causes them to be weak and weak, and this is not really good for their health. Okay, let's talk about some questions that what happens to body in anorexia nervosa. Untreated anorexia nervosa can lead to damaged organs, especially the heart, brain, and kidneys. Anorexia nervosa really damaged the heart, brain, kidneys, and it can cause drop in blood pressure, pulse, and breathing rates, and then loss of fear. Causes. The exact causes of anorexia nervosa are unknown. However, the condition sometimes runs in families. Young women with a parent or sibling with an eating disorder are likelier to develop one themselves. Then there are psychological, environmental, and social factors that may contribute to the development of anorexia. The exact cause of anorexia nervosa is not known yet, but it is said that it may runs in families, that if you have, like, it is genetic. You can say that it is genetic. If someone in your family has this, there is a probability or chance that you can get it as well. Okay, why do people become anorexic? The causes that may contribute to a person developing anorexia nervosa include psychological factors such as high level of perfectionism, that those persons who are going through anorexia nervosa, they want them to be perfect, or obsessive compulsive personality traits, feeling limited control in life and low self-esteem, a tendency towards depression and anxiety, and a poor reaction to stress. Those persons become really very stressed in a normal condition as well. They feel depressed, stressed, and they have low self-esteem. Okay, anorexia's effects on our body organs. Heart problems are the most common cause of death for people with anorexia. This eating disorder can cause the heart to beat too fast or too slow. It can cause heart failure as well. Anorexia causes bones to weaken and thin. This disorder, anorexia nervosa, may affect our brain and heart. And this is very dangerous for the person because you might die with this. And there are many persons who are dying because of this disorder. Okay, parts of the brain undergo structural changes and abnormal activity during anorexic states. We have talked about the heart problems. Now we are talking about brain. Reduced heart rate, which could deprive the brain of oxygen. Nerve-related conditions including seizures, disordered thinking, and numbness or odd nerve sensations in the hands or feet. Because of the decreased heartbeat rate, the reduced heart rate, because it doesn't supply blood normally or equally, and if blood is not supplying to your brain as it is required, then there is no oxygen in that area of your body, and consequently you might die if this stage lasts for a long time. Okay, So the next thing is that who is most likely to become anorexic? It is a question that whether it is more in males or in females. So it is more common among girls and women than boys and men, and yet more common among girls and younger women than older women. And the discussed eating disorder, the is more than twice as prevalent among females, 3.8%, than males, 1.5%. This disorder is more common in girls. It is not in males as such, but it is more common in females because females are more conscious about their fitness, about their physique, we can say. So they move towards the dieting procedure, which is not good for their health. Like um, you can say that heavy diet procedure in which you just can't, you just forget that forget that what is healthy and what to eat and what to not. Okay, age plays an important role in how people cope with disease both physically and mentally, and this is precisely the case when it comes to eating disorders. As specified earlier, eating disorders can lead to various other serious health problems such as age increases, so do as the risks these entail. They become very serious with age. Any disorder, it is not like that such eating disorders, any kind of disorder become very serious and chronic with age. Then there is treatment for anorexia. Treatment for anorexia usually involves a combination of talking therapy and supervised weight gain. There is no such medicines, you can say medicines or things like that, injections, not all of that. There is just therapies and and you can need a nutritionist who can provide you a weight gain plan, etc. It's important to start treatment as early as possible to reduce the risk of serious complications, particularly if you have already lost a lot of weight. Psychotherapy, family-based therapy. This is the only evidence-based treatment for teenagers with anorexia. And then there is individual therapy for adults. Cognitive behavioral therapy, specifically enhanced cognitive behavioral therapy, has been shown to help. For the treatment of anorexia, there are psychotherapies. You only have to. There are therapies and not like medicines, etc. So therapies help to prevent the people from anorexia. The nutritionist or psychiatrists tell them what to do and what to not. So this really help them in that process. Okay, are anorexia and anorexia nervosa the same? The question is really very important, that are anorexia and anorexia nervosa the same? So anorexia describes a simple inability or aversion to eating, whether caused by a medical problem or a mental health issue. While anorexia nervosa, however, is the name for the clinical eating disorder, the main symptom of which is self-starvation. In anorexia, you simply just don't wanna eat, or it can inability to eat, you can say, and it may be because of any medical problem or mental health issue which you are going through. But in anorexia nervosa, you actually gone on self starvation, that you start starvation by your own, for your own self, which is not good for your health. So these two terms are different, and you should know the difference between these two terms. Okay, what are the do's and don'ts? Do encourage your friend or family member to seek professional help. The friend or your friend or your family member who is going through anorexia, this eating disorder, you should encourage them to seek professionals help. Don't be critical of someone's appearance. We should not criticize someone for their appearance, for their behavior, for anything. We should not judge someone. Do show compassion and care and listen to them non-judgmentally. We should listen to them and give them advice. We should listen to them basically, because if we are not able to listen them, we could not help them. Don't get frustrated or annoyed by the person's eating habits or try to force them to eat. We should not get frustrated. If the person is eating more, if the person is eating less, we should not get frustrated, and we should not force them to eat less or eat more. We should just listen them and calm them and advise them, and this is the best thing, as you say, therapy for them. Okay, let's end with these quotes that let food be the medicine and medicine be the food. This is a great quote that food can behave as medicine. If you know what to eat and what to not, this is a really very this is really very helpful in maintaining a good lifestyle. Then there is think positively and exercise daily, eat healthy, work hard, stay strong, build faith, worry less, read more, and be happy, everyone. Thank you so much for your attention.